Subscribe to the channel. The nurse who poisoned. The night shift always smelled like disinfectant and dying breath. Lights stayed dimmed. Machines whispered. And the hallways of the hospital became long tunnels where time stopped moving. That's where she worked. Quiet, reliable, trusted. A nurse with soft hands and a calm voice. The kind families thanked. The kind doctors depended on. No one noticed the pattern at first. Patients who were improving suddenly crashed after midnight. Heart rates collapsed. Lungs failed. Alarms screamed, then went silent. Death certificates listed natural causes. Old age, complications, fragile bodies giving up. That's what everyone believed. But she was there every time. She memorized routines, learned which cameras were broken, which rooms were farthest from the nurse's station. She knew which patients had no visitors, no advocates, no one who would question why a stable chart turned fatal before morning. Her weapon wasn't loud. It didn't leave bruises. It came in syringes, clear liquids, tiny doses, enough to stop a heart slowly, enough to look like fate. Subscribe to the channel. At first, she told herself she was helping them, ending suffering, giving peace. That lie didn't last long. Soon, she wasn't choosing the sickest patients. She was choosing the quiet ones, the forgotten ones, the ones who wouldn't fight back. Some nights, she stayed in the room and watched. She watched monitors flatten. She listened to the last breaths. Sometimes she whispered apologies. Sometimes she smiled. When staff rushed in, she played her role perfectly. Shaking hands, urgent voice, fake panic. She cried with families. She attended funerals. The body count grew. A young doctor noticed something wrong. Too many deaths on one shift. Too many charts signed by the same nurse. He raised concerns. Management ignored him. Hospitals don't like scandals, especially ones wearing scrubs. Then came the mistake. One patient survived. The dose was wrong. Not enough to kill, only enough to paralyze. When the patient woke in intensive care, unable to speak but fully aware, they wrote 3 words on a clipboard with trembling fingers. She did this. Investigators moved quietly. Medications were tested. Logs reviewed. Patterns emerged like blood through white sheets. The nurse was arrested at work, still in uniform, still calm. She never screamed, never denied it. In interrogation, she said the nights were lonely, that the power felt warm, that deciding who lived and who died made her feel seen. They later linked her to dozens of deaths, some confirmed, some suspected, some never proven because bodies had already been buried, burned, forgotten. Even now, former patients refuse night care. Families still ask hospitals one question before admitting loved ones.